Good evening, everyone, and welcome to tonight's webinar, Allied Health Support for Aged Care Residents During COVID-19. My name is Kiara Beans, and on behalf of GPEx and Country SAPHN, I'm excited to offer this third and final webinar in our three-part series with Jane Calligeros. Jane is the owner and lead consultant at CDM Plus, who provide training and resources for primary healthcare, community, and aged care. Jane has an extensive background in nursing, has been working in general practice for the past 10 years, and holds postgraduate qualifications in chronic disease management. I would like to acknowledge that we are hosting this webinar from the lands of the traditional custodians. I acknowledge the traditional custodians of the various lands on which you all work today, and the Aboriginal and Torres Strait Islander people participating in this webinar. We will have a short Q&A session at the end of Jane's presentation. However, please feel free to utilise the chat option at the bottom of your screen throughout the webinar, and Jane and I will endeavour to get to you. Thank you, and I'll pass over to Jane.
Thanks, Kiara. So welcome everyone to the last webinar in the series. We're going to be looking at the temporary MBS items for COVID-19 for residential aged care facilities. So we're looking at the allied health support for residents during COVID-19. So for those that missed the last two webinars, those recordings will be available on the PHN website. The first webinar, we looked at the general practitioner and other medical practitioner item numbers for residents with chronic conditions. The second webinar, we were looking at the mental health support for residents through that expansion of the Better Access initiative. So tonight's learning objectives is to identify the temporary MBS changes for allied health services and to apply that learning to coordinate and deliver allied health support for aged care residents. So we're going to be looking at the eligible patients, the types of services available, how those residents can actually access the services, the different plans and referrals and those pathways that are currently existing, and then the temporary pathways in place due to COVID-19, and then any claiming and restriction, additional requirements to that, and then an overview of those allied health numbers. We've also got a number of resources that you'll be able to access for free as well, just because there are so many new item numbers, and you'll see that when we get towards the end of the presentation tonight. So how did some of these initiatives come about? There's a couple of different things that happened. So, you know, COVID-19 has had many impacts on Australians, especially in the delivery of health services. Aged care did face a number of challenges for providers as well as the residents. So we're going to reference a few different reports during this presentation, and the links and references will be at the end of that presentation that you'll have access to as well. So if you haven't had a chance to read some of those reports and you want to, you'll have access to those. So the first one we're just going to look at was where the initial 6 recommendations came from. So the aged care and COVID-19 was a special report and outlined 6 recommendations. That was through the Royal Commission into Aged Care Quality and Safety. And they handed a special report on the COVID-19 pandemic back in October last year. So for those that haven't had a chance to see that report, it's only around 40 pages. So as reports go, it's not too long, I guess. And then the second one we're just going to have a look at now was the progress report against those 6 recommendations. So the third recommendation in particular is how we came about to have these additional item numbers. So the third recommendation was that the Australian government should urgently create MBS items to increase the provision of allied health services, including mental health services to people in aged care during the pandemic. So the Australian government accepted and created additional MBS items. So 2 for that one. For a cost of $47.6 million for mental health and allied health services for residents. So in addition, there was also funding for the PHNs to provide in-reach group re-ailment programs as well. So we broke those two other webinars. So we looked at the mental health services that were available. And then tonight we'll look at those additional allied health services. So the mental health services we will have a look at a little bit later in the pathways, but there was some expansion to the better access to psychiatrists, psychologists and general practitioners through the MBS initiative, Better Access. So it increased the number of services from 10 individual psychological therapy sessions to 20. So the allied health services that we're going to be talking about tonight, so increasing the access to the allied health services was hoping to improve the access and deliver like additional services for residents. So the hope was to improve residents' physical and mental health to address issues around deconditioning caused by isolation, and to provide psychological therapy sessions to people that will benefit from a more structured approach to mental disorders. So the measures include additional mental and physical therapies delivered by a number of different allied health professionals, including psychologists, social workers, occupational therapists, physiotherapists and exercise physiologists. So the third report we're looking at is the National COVID-19 Aged Care Plan. The links are there for that one as well. And they talk about the COVID-19 related deconditioning of older people. So evidence continues to emerge from COVID-19 experience that older people that can't access that regular health service in residential aged cares or in home care, we're choosing not to access services to minimise the risk of exposure to COVID-19, or patient or residents that were transferred from aged care facilities to hospitals. So they found that they were having increasingly worse clinical outcomes, and that's why some of these initiatives have come about from that. So deconditioning, it's a complex process, and it's a physiological change following a period of inactivity and bed rest. So increasing the access for these residents to allied health services in person. The other options are remotely via telehealth to help residents maintain and improve their health and wellbeing. So the temporary allied health numbers are meant to support providers to deliver these additional health services for patients living in residential care. So they build upon those existing pathways, and we've got some flowcharts and resources to help kind of illustrate that a little bit better as well. And they can access those through a couple of the different pathways. So through the chronic disease management pathways and through the Aboriginal and Torres Strait Islander health assessment pathways. I've got a couple of the frequently asked questions that kind of were brought up in some of those fact sheets, and so as they are relevant, I'll talk about those as we go through, and hopefully that will answer some of those main questions that we might have as well. So residents in the residential aged care facilities will have access to more Medicare subsidised services. The allied health telehealth numbers don't need to be bulk billed. However, the provider must ensure that financial consent is obtained prior to any service which attracts a co-payment. So patients should actually talk to their GPs about the other care needs, including the options for accessing allied health. And we'll talk about that in a little bit in the next part of the presentation. So the three main factors contributing to deconditioning were psychological, nutritional and physical. So allied health plays a really big part in the rehabilitation for these patients, as well as prevention of further decline. So I'm just going to show you. The last report we've got there is just from the Royal Commission. So it's the final report. So for those that haven't, there's a number of volumes. I'm just going to give a brief overview of the first 3 volumes. So volume 1 talks about the background to the Royal Commission inquiry, how it was conducted, and presents a full summary of the final report and all the recommendations. And it's a little bit of background of how the other part of these initiatives came to add these additional services as well. Volume 2 explores the current aged care system, so problems of access and the extent of the substandard care and other systemic problems. Just mentioning in there, so when Commissioner Briggs put that report together, some of the statistics were around substandard care, and it was around 1 in 3 people accessing residential aged care and home care services had experienced substandard care. So a lot of these additional services are hoping to remove that as an issue from residential aged care. Volume 3 outlines the new system for aged care, addressing issues around access, financing, workforce, governance, Aboriginal and Torres Strait Islanders, regional, rural and remote Australia, disability, younger people in aged care, and a lot more. So I recommend having a read through those. You can order a hard copy or download it straight from the Royal Commission website as well. All right, we're going to look at some of the allied health pathways that are currently available. And I think there's a little bit of confusion, I think, from that primary care level as well as in the residential aged care about some of these referral pathways that exist. So we're going to take a look at which residents are actually eligible for the additional services and the different referral pathways for GPs and other medical practitioners to refer to allied health. So residents of aged care facilities can actually be eligible for Medicare rebates for up to 5 individual allied health services when a GP has contributed to their multidisciplinary care plan. And that needs to be prepared by the resident, by the facility for the resident, and then referred for the allied health services by the GP under that MBS item 731. So these Medicare rebatable allied health services should not replace the services that are expected to be provided to residents by the facility as a requirement under the Aged Care Act 1997. So under that legislation, approved providers of residential aged care services are required to provide therapy services like recreational, speech therapy, podiatry, occupational therapy and physiotherapy services to certain residents as defined by their funding classification at no additional cost. So the services to be provided are maintenance therapy delivered by health professionals or care staff as directed by health professionals that are designed to maintain the residents' levels of independence in activities of daily living. And then more intensive therapy delivered by health professionals or care staff as directed by health professionals on a temporary basis that's designed to allow residents to reach a level of independence at which maintenance therapy will meet their needs. So basically there is some already accessible allied health services as part of that maintenance and needs for the resident. The next part we're going to look at is the additional provision of services that are available now. So this is the existing pathways for patients that need additional services and that have chronic and complex care. So you can see from this flowchart, I've got the pathways there. So the first one in the blue there, we've got if the resident has a residential aged care facility care plan. So that's been developed by the facility. And then the GP has contributed to that plan. So the 731 needs to have been billed. The resident can actually access those 5 individual allied health services. The second pathway is that the resident has completed a health assessment for Aboriginal and Torres Strait Islander people. So if that has been completed, then they also have access to 5 allied health services per calendar year. And then the third option to access allied health is if the resident has type 2 diabetes, plus that residential aged care facility care plan, and the GP has contributed to that plan. So as an example, if the patient had diabetes and they had that residential aged care facility plan, plus the GP's contribution with the 731, they could access the 5 under that blue section, plus the group services available. And these are the existing pathways. We haven't gotten to the additional temporary MBS items that are on top of those ones. So that's just a summary. So they can access, eligible residents can access under the multidisciplinary care plan. So that's that contribution to the facilities plan. If the patient has type 2 diabetes, plus the facility plan and the GP's contribution. And then if the Aboriginal and Torres Strait Islander pupils have had a health assessment in the aged care facility, they can access. So from the 10th of December last year until June 22 next year, the temporary MBS items have been made available to help better support residents in the aged care facilities during COVID-19. So they apply for those patients that have these existing plans and including a shared care plan as well. So the reason a lot of these items have kind of been built on to provide additional services is that they're actually adding for the providers a flag fall fee to help cover the costs of some of those expenses to travel to the residential aged care facility and provide a face-to-face service. So who is eligible? The temporary allied health MBS telehealth items are available to eligible patients living in the residential aged care facility whose healthcare is being managed under an eligible treatment, management or care plan. Okay, so that's what we've got there. Those residents that services are required to be provided at no cost. So those ones that we mentioned earlier about the maintenance therapies, etc., will continue to access those services under that pathway. Okay, so the new allied health MBS items that are RACF specific do not change the obligations for the aged care providers. Okay, but the residents are able to receive additional services if required. So just looking at that first pathway, so that means that the GP will have to do the 731. And when we get to the MBS items, you'll see that that 731 is being replaced by a temporary item number so that the GPs and other medical practitioners can actually claim a flag fall item for that first patient on attendance. Okay, so to access the allied health pathways, the GP will need, or other medical practitioner will need to complete that contribution to the existing plan that the residential aged care facility has prepared, and that the residents' health needs include behavioural or lifestyle needs as well. So the plan needs to be multidisciplinary, so it can't just it's not meant to be for just simple care. So it means that the residents have a chronic medical condition and they also have complex care needs. So that requires ongoing care from a multidisciplinary team. So it's similar to what we have in primary care under the 721. So they actually need the GP and 2 other providers. So the expectations in contributing to these existing plans is that the GP will actually directly collaborate with the residential aged care facility. Okay, and it's usually done at the request of the facility. So I've just got, so we need the GP and 2 other providers as part of that care. So a couple of the frequently asked questions that I'll just kind of add in there as well. So can a patient receive the rebates for allied health services if that contribution has been provided? So in general, if the GP has contributed to that multidisciplinary care plan, then the resident can actually receive those 5 individual allied health services. So it's similar the way that referral form is completed, that it goes for per calendar year, the number of services. So the next frequently asked question that was there was, can an allied health professional or family member request that a contribution to a facility care plan be done for a resident? So the answer to that was that it wasn't appropriate for a third party to either request the GP's contribution on behalf of the aged care facility or to direct the GP on what their contribution should be. So they just say that the GP would use their own judgment to determine the services that the resident requires based on their health and care needs identified in the actual plan. So like the other chronic disease management items that we do, the GP's decisions based on assessing the resident's clinical need for services. So next question around that was, can both high care and low care residents be eligible for allied health services? The answer for that one was yes. However, the Medicare rebatable allied health services should not replace services expected to be provided that we mentioned before around the maintenance therapies. And like the other CDM items, so the ones that we do in the primary care setting, so 71, 73, we can't actually bill another item on the same day. So can a item be claimed on the same day, such as a normal consult with the same resident? So it's saying in general, a separate consult should not be undertaken unless it's clinically indicated that the problem should be treated immediately. So if you do, it needs to be annotated, separate consultation clinically required. So those frequently asked questions are in that Quanda document, and it's a resource listed at the end of the presentation if you want to have some further reading on that one. And when we get to the temporary numbers, we've also got access to the fact sheets, and we've got those as links at the end of the presentation as well. So what are the steps? So for the 731 or the new items that are available, that we'll talk about in the next bit. So the 731, the temporary number is the 93469. So what are the steps involved? So this item, including the components, are very similar to item 729, except this is available for residents in the aged care facilities. So it's only where the plan has been prepared by the facility or from a hospital in which the resident's being discharged. Like the other items that we do for chronic disease management, the minimum claiming period is within 3 months of a previous claim for the same item. There is the same exemption in the exceptional circumstances. So if the GP does wish to claim sooner than that 3 months, under exceptional circumstances, they'll have to notate the voucher for that as well. Okay, so referrals, what paperwork do you need for the allied health? So the referral forms are the ones that I've got links to in the next slides, but the GP and the aged care facility should work together to assess and plan that care that the resident needs. However, it's the GP that needs to be responsible for identifying the needs of the allied health services and for making the referrals. So that part is for the GP. And then one of the other requirements for that one, so on the referral form, the following requirements are needed. So the need for the allied health services must be identified in the patient's plan. The services must be provided to the patient individually and in person. And with the temporary items, we've also got the additional options for telehealth there as well. and that the services must be at least 20 minutes. So the other referral pathways for the residents that have type 2 diabetes, and so it's a different referral form for that. They're the group services for this referral pathway. And then the third way is through the Aboriginal and Torres Strait Islander Health Assessment. So the new temporary arrangements actually are replicated for the 715 that we would do in primary care. And there's a new additional number for that. So for the GPs, that new 715, it's the 93470. So the referral form's the same, and the new arrangements are replicated for the Aboriginal and Torres Strait Islander patients that are living in the residential aged care facilities. So they're still eligible to claim those 5 health services, 5 allied health services. So the other allied health that can be accessed is under the mental health plans, and we spoke about that in the last session. So I'm just going to touch on it briefly because allied health services are still included in this. So if you want more information on the mental health, you can go back to that previous presentation. But the Better Access Initiative is just looking at the eligible aged care residents. So it was actually increased from the 10 individual and group sessions. Now the residents can access up to 20 individual psychological services each calendar year. So for those that don't know much about that program, it was initiated back in 2006, and it was to introduce education and training for mental health workforce and increase the access of services and affordability for psychological services. So what we're looking at for those residents is that they can actually, those mental health services can be provided by the psychological therapy services by clinical psychologists, focused psychological strategies by eligible GPs, other medical practitioners, registered psychologists, social workers, and occupational therapists. So for residents that need to access these mental health, allied health services, they'll need to do that through 2 different plans. So there's 2 pathways. So it's through the mental health treatment plan that's done by the GP or the or other medical practitioners, or the psychiatrist assessment and management plan. Okay, so they're the 2 ways to access those mental health services. And then once the plan's in place, there needs to be a referral with a number of sessions. So the GP needs to nominate the number of sessions on that referral form, otherwise it will kind of bounce back. So how many Better Access sessions can they be referred for in a single referral? And we can do up to 6 sessions. Okay, it must be specified on that referral. Can a referral be used across multiple calendar years? As long as there's no more than 20 services across 1 calendar year, then it can be the same referral form. So we're going to touch on the MBS items now, and this is where it can be a little bit confusing. So there are temporary MBS items in place for GPs, mental health, allied health providers, and other allied health providers. Okay, so I've set out the pathway, and I'll show you a little flow chart that we've put together. So these services are available from December last year up until June next year. Okay, it's to help support the residents affected by COVID-19. And a lot of these item numbers are attached to a flag fall number for the first resident that service is delivered face-to-face. Okay. So what are these temporary changes, and how does that affect the referral pathway? So you saw on the previous flowchart the pathway that was existing. So if the resident has a residential aged care facility care plan plus the GP contribution of the 731, or a health assessment for an Aboriginal and Torres Strait Islander resident, then they can actually access 5 additional individual physical therapy services. So it is in particular for the physios, exercise physiologists and occupational therapists under that one pathway. And the other extra services they have access to, so if the resident has type 2 diabetes, then they can get 2 additional services on top of the 8 that they already have. Okay, I know it looks a little bit confusing, but no additional paperwork needs to be added into that. So if they have that referral form already, then it can just be added on. So no new referral form is required if the additional services were already included in that patient's eligible treatment, management or care plan. Okay, the new temporary additional physical therapy items must be provided face-to-face. The group therapy items replicate that existing one through the diabetes education, exercise physiology and dietetic services, but it allows the providers to claim the flag fall item number for that first patient in the attendance. So just an overview of the GP and other medical practitioner items and the flag fall items altogether. So the GPs and other medical practitioners plus the other allied health services can claim the flag fall for some items, and I've got those in a separate resource that you can view a little bit more easier and you can use. And the flag fall fee expanded for the GP and other medical practitioner services to include the multidisciplinary care plan under that item number 93469 and the Aboriginal and Torres Strait Islander health assessment under the item number 93470. I did click through. Didn't think it went. Okay, so you can see there we've got the 4 different flag fall item numbers. Tonight we're talking about the allied health ones in particular, so it's the 90004. So the rule is the same for all of them. It can only be claimed for the first resident in attendance, and it's for face-to-face visits. So the allied health one, the 90004, it's worth $41.65. The 90003, so that's for the allied mental health professionals, and I've got the list of item numbers there that you can refer back to as well. So for that flag fall item, the 90003, it's $40.35. The 90002, it's $41.60, so that's for other medical practitioners. And for the GPs, that 90001, it's $57.25. So the whole reason around the temporary flag fall, it's to just help support the providers that are actually providing these services to residents.
And just a quick question.
Yep.
Someone's just said, I'm pleased that flag fall support is in place for GPs and allied health, but can I check what level of care coordination financial support is being supported for the RACF?
Sorry, just repeat that one again.
But can I please check what level of care coordination financial support is being supported for the RACF?
I'm not sure funding wise what their receipt, like as addition to the allied health or providing the allied health services.
I'm not sure. We can take this one
yeah,
off and
I
can
have a look.
Contact her. No worries.
Yeah, that's fine. Okay, yeah, so flag fall, it's for the first resident that is seen for that attendance. and it's for the face-to-face visits on those. So these are the GP temporary items. So as you can see, the existing MBS item was 731. The temporary one that you can claim the flag fall item with is the 93469. And then we've got the Aboriginal and Torres Strait Islander health assessment. So the existing item, as we know, 715. And the temporary items 93470. So that one will allow you to add on the flag fall item. So for GPs, that's the 90001 that you can add to either of those items. So same for the other medical practitioners. The existing item for a contribution to a multidisciplinary plan at the aged care facilities 232. So the new item is new temporary item is 93475, and for the Aboriginal and Torres Strait Islander health assessment, it's the 228. The new item is the 93479. So both those new face-to-face items actually attract that flag fall item. So for the other medical practitioners, the flag fall item for this one is the 90002. So the next one we've got there is for the allied health services. So they've introduced a lot of item numbers. The resources, we've had to kind of split it over a number of resources because there's so many numbers. So the initial and long services have been introduced. So it's once per patient per calendar year for those initial or long services. They must be face-to-face, and then there's subsequent and standard. So providers can actually claim the flag fall for the attendance, so face-to-face only. And then we've got face-to-face telehealth or phone options for those. So if we get a chance, I'll show you those resources at the end. We can just have a look at how they're set out and where you can see the flag fall item if you need to attach that for any of the services. So we've actually got some resources that you can access as a digital PDF, and then you can actually download and print those if you want. So in total, because there's so many additional allied health and GP numbers, mental health numbers all worked in, we've put them across 6 different PDFs. So you can see one, we've just got an example there. You've got access to those for free. So you can either just visit the website, you've got them straight there on the online module section, or you can just scan the QR code, but I'll bring a couple of those up so we can have a look. So we'll have a look at the allied health options first, because that's what we're looking at tonight. And then if we've got some time, I'll show you the other ones for the GPs and other medical practitioners as well. So you can see this is one of the billing sheets. You can see why it's so spread out. So this is for the allied health providers. So you can see the left column, we've got the face-to-face. So it starts with the initial and long attendance. So anything that's marked with an asterisk means that you can add that flag fall. So you can see that down the bottom bit there. The telehealth items are in the middle section, and then we've got the phone items at the in the last column. So that's if residents are accessing that under the multidisciplinary care plan. So the GP has done that contribution to the plan. The second pathway is under the Aboriginal and Torres Strait Islander health assessment. So same layout. So we've got the face-to-face visits. So as you can see, they've all got the asterisks that you can attach the flag fall item number to for the first resident. Then we've got the telehealth in the middle section, and then the phone on the end. And then the last one we've got there is for the group services. So the existing ones, if anyone has used these before or seen them before, is these patients that have the type 2 diabetes, they can actually access those originally under the existing Pathways 8 services per calendar year. With the additional temporary numbers, they can access an additional 2 exercise physiology under that pathway. And then one of the other ones I just want to show you is for the allied mental health services. So you can see there's so many services. I'll just make that a bit smaller. So on the left, we've got the clinical psychologist items, registered psychologists, occupational therapists, and the social workers. We've got the face-to-face in the centre. If that throws you off a little bit, there was just less of those items. So same thing, it's the asterisk there to notate that you can add the flagfall item, and that's the 90003. And then we've got the phone ones on the end. And then as well, we've got the GP numbers. So those that are a bit unsure, so there's general consults there, and then we've got the other mental health items as well. And then we've got the contribution there, you can see, for the multidisciplinary plan and the Aboriginal and Torres Strait Islander health assessment. So anything that's notated with the asterisk can have that flag fall for the first resident. So for the GPs, it's that 90001. And then for the other medical practitioners, there's also a billing sheet there for you guys as well. So you can see the face-to-face attracts that flag fall. The flag fall's the 90002. And then we've got the telehealth and phone numbers as well. So you can see that that contribution to the plan for the other medical practitioners is the 93475. And then the Aboriginal and Torres Strait Islander health assessment is 93479. So you've got access to those. They're for free until June next year. They'll be available on that website there that you can access. And that's just the smaller version of those. So for any of the GPs that are on tonight, has anyone been using these additional items that are currently in place or didn't know that much about it? If you want to pop some comments in the chat or questions. So the allied mental health services as part of tonight's one. So it's psychologist, occupational therapist, social worker that they can access in under those ones. And then the allied health services under the multidisciplinary care plan. And the Aboriginal and Torres Strait Islander health assessment as well. And then the group allied health services. So it's impossible to remember all of those item numbers, and we don't expect anyone to. So sometimes it's easier if you provide the service unsure, you can just, refer back and circle the number on those. I've got a list of the resources and reports that we referred to in this session tonight. So all the reports are at the top. There's additional statistics and things that we referred to in the other sessions, and I've kept them on this slide as well. So some things from Gen Aged Care and the Australian Institute of Health and Welfare as well. And then we've got our website there as well if anyone wants to jump on there. And then we've got the additional referral forms as well. So when we spoke about this sample mental health templates, if anyone was looking at any of those, and some great resources on the Better Access initiative. Medicare also has a number of fact sheets that are available. So for anyone that hasn't had a chance to jump on the website and have a look, there's a number of fact sheets that you can access. So I'm just going to bring those across so you can see that as well. So there's, I think, 3 fact sheets altogether. So one's for allied health, there's one for GPs, and there's one for the mental health additional temporary MBS items. for anyone after additional services, allied health, they can refer back to the Country SA Services Directory and the PHN if they've got any additional questions around allied health or access to additional services. And I think that's kind of it from me. Did anyone have any questions?
Thanks, Jane. Before we jump into any questions, I'm just going to send through the evaluation link in the chat, please. So before you log off, if you could please fill that in, that would be great. Otherwise, happy to answer any questions. No questions at all, guys? If there is something that you would like to ask offline, feel free to send me an email as well, and I can follow it up with Jane and PHN, whichever is required. Jane, there's been no questions, so I might stand for a couple of minutes, but thank you to everyone for attending. Please don't forget to fill out that evaluation. The recording and your statement of attendance will be sent to you over the coming week. Like I said, any questions, please feel free to email me or give me a call. Thank you to everyone that's jumped on board this webinar and the last two, and hopefully we'll be able to see you all soon shortly.
Thank you.